Hola, ¿qué tal? Muy buenos días.
Good morning. Thank you for joining us today for this press briefing organized by the Pan American Health Organization on COVID-19 in the Americas on this Wednesday, October 20th, 2021. My name is Sebastián Oliel with the Communications Department at PAHO, and as every week, this session will be about an hour long. We have already received your questions via email, and you can also send questions live and through the chat by using Q&A button. Please do include your name and media outlet when sending your questions. Also, let me remind you that we have simultaneous interpretation into English, Portuguese, French, and Spanish, and that you can select that by clicking on Interpretation. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the evolution of the pandemic in the Americas, in connection also with vaccine coverage and surveillance of the virus SARS-CoV-2 in the Americas. Today with Dr. Etienne, we also have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldiguieri, Incident Manager for PAHO, for COVID at PAHO. And now I'd like to invite Dr. Carissa Etienne to share her remarks. Thank you, Sebastian.
And thank you for joining today's press briefing. Over the last week, there were nearly 817,000 new COVID infections and over 18,000 COVID-related deaths reported in the Americas. Cases are dropping across North America, although we are seeing hospitalizations increase in Canada's eastern provinces and deaths increase in Mexico. COVID infections and deaths have gone down in most countries of Central America. In South America, while most countries are seeing continued reductions in cases and deaths, Bolivia and Venezuela are reporting a rise in new infections. However, the situation is more severe in the Caribbean. The Dominican Republic and Barbados are reporting over 40% jumps in new cases over the last week. In fact, half of Barbados's cumulative COVID infections since the pandemic began have been reported in the last month. Puerto Rico, Trinidad and Tobago, and Martinique are also seeing a jump in new infections. And cases remain high in St. Martin, St. Kitts and Nevis, Anguilla, and the Cayman Islands. So we continue to urge countries, especially those in the Caribbean, to maintain and prioritize public health measures to control the spread of COVID. These measures, along with widespread vaccinations, are the best option to control outbreaks. The good news is that 41% of people across Latin America and the Caribbean have been fully vaccinated, but this is not an even coverage. Some countries are higher and others are much lower. Another 4.6 million COVAX vaccine doses will reach our region by the end of this week, so more people can be protected. But even as vaccine coverage increases, we will continue to see new infections throughout our region. Today's COVID vaccines are very safe. They are also highly effective in preventing severe disease and death and can stop most infections. Like other vaccines, COVID-19 vaccines were designed to save lives and protect us from the virus's most serious symptoms. And they are clearly achieving that. However, we need to continue to track and manage infections closely to detect and minimize community transmission. So today, I want to spotlight surveillance efforts in our region. Surveillance has always been the eyes and ears to guide our COVID response, from when the first case was detected in our region as we navigated our pandemic peaks and as we continue to track emerging variants. As we look to the future, surveillance and early warning, integral components of disease control, will remain essential to identifying new risks and managing and responding to this next phase of the pandemic. To improve and evolve epidemic surveillance in the region, countries must act locally. They must act smarter and act together. More and more, we're seeing how local hotspots, so to speak, are driving national trends. And that's why health authorities should have a clear picture of what is happening at the local level and quickly communicate both the risks and the public health measures needed to reduce transmission. By empowering local institutions like laboratories, public health schools, and universities to diagnose new infections locally as part of the national surveillance efforts, local municipalities can detect risk more quickly and remain on the pulse of emerging trends. Enhancing homegrown detection capacities also means ensuring that there are enough local testing sites and that clinicians know where, when, and which COVID tests are worth sending for epidemiological surveillance. To act smarter, countries should also look for ways to build on existing surveillance networks. By integrating COVID-19 with surveillance activities for other respiratory viruses like influenza, countries can monitor diseases more efficiently and sustainably. Today, together with the US Centers for Disease Control and Prevention in Atlanta, the CDC, PAHO is working to implement a new PCR-based multiplex protocol that would allow countries to simultaneously detect COVID-19 and influenza from the same sample. As countries work to become more self-sufficient in their pandemic response, this new integrated testing strategy will help countries sustain their surveillance efforts. Acting smart also means making the most of what the data tells us. And that's why PAHO has developed a modeling tool that tracks cases and forecasts short-term trends. This modeling tool helps countries measure the impact of different public health measures to inform their responses. Today, countries in the Caribbean, including Antigua and Barbuda, Barbados, Dominica, Grenada, St. Lucia, and St. Vincent and the Grenadines, are leveraging these models to manage the ongoing outbreaks. And as the pandemic continues to evolve, we encourage countries to use this tool to design their responses and apply public health measures at the right time. Finally, we also want to see countries continue to act together to improve our regional surveillance. Thanks to the efforts of countries across the Americas, our region has built a robust and innovative surveillance network that enables us to keep a close eye on this virus and on the emergence and spread of COVID-19 variants. Building on the legacy of our region's long-standing influenza and other respiratory viruses surveillance and laboratory networks, we now have a robust network of 45 national public health labs, and that's growing, that runs COVID molecular tests from all over the Americas, standardizing laboratory protocols, conducting trainings, and donating more than 21 million COVID PCR tests and nearly 18 million rapid diagnostic tests to countries across our region. We must keep investing in and expanding this regional network. This platform helps us track COVID-19 cases and can be adapted to identify other viruses and other emerging pathogens, serving as the region's backbone for pandemic preparedness. On another note, this week marks 30 years since the last case of polio in the Americas. A boy named Luis Fermin Tenorio in Peru, who later became a polio volunteer. This extraordinary accomplishment was made possible by mass vaccination efforts and robust epidemiological surveillance that was underpinned by a strong network of laboratories. And our region was the first to do this. Even though our region has not seen a polio case due to wild polio virus in 30 years, all of our member states continue to monitor for polio and to vaccinate against the disease today, so we can all be kept safe. As we recognize World Polio Day this Sunday, we are reminded of what this region can achieve when it works together to keep health threats in check, when we protect the most vulnerable and ensure that all people have access to life-saving vaccines. Thank you, and over.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we are going to move on to answering the questions that we have received via email and the ones that we are receiving now through the Q&A. Please remember to send your name and also media outlet together with your question. The first question was sent by Yvette Guzman Castillo, who is the editor of Núcleo Comunes in Peru. And she's asking, what is the quantity of vaccines via the COVAX facility that will be sent to Peru this year? She's saying that they will only be 2.5 million, or that they have only received 2.5 million in addition to the 3.8 million of Pfizer vaccines, or will they be receiving more? Dr. Barbosa, thank you for the question. In all of our press briefings, we have highlighted the difficulties of having equitable access to vaccines. COVAX Secretariat has been communicating the difficulties faced because producers are given priority to bilateral agreements with the countries because the prices at which the vaccines are sold under those bilateral agreements are higher than the prices through COVAX facility, and the developed countries bought most of the production. And also there was a problem with vaccine production in India, and India continues not to authorize the exportation of vaccines. That's the reason why COVAX has delivered a quantity of vaccines that is much lower than what is needed for the countries in Peru, as you have just mentioned. Out of the 13 million requested by Peru through COVAX, they only received 2.5 million, and now they will be receiving 3.8 million of Pfizer vaccines, and we are expecting to provide 1.6 doses of Sinopharm. So I think that this will continue. The COVAX Secretariat has the intent to deliver at least 80% of what they requested by year's end. So PAHO, given those limitations, is working to increase donations because, for example, Spain has already sent some donations, and we are also working for 500,000 vaccines from Germany to be sent as a donation as fast as possible to Peru. And also PAHO is asking countries to have direct purchases through our revolving fund. So these are the expectations. We are always in contact with the health ministries to report on the dates and the quantities, because when we receive the information from COVAX Secretariat that the doses are already assigned or allocated, we already establish contact to determine the details from the financial logistical point of view to speed up the delivery. So that is important to guarantee equitable access and also to have more vaccines for the Caribbean. And this is one of the greatest challenges that we have right now. Thank you. Thank you, Doctor. The next question is by Teresita Moreno from Mexico. She would like to ask what the experts' opinion is about the situation in Mexico, that mass events have already been authorized, such as the next parade on All Saints Day, and they are expecting participation of more than 500,000 individuals. Thank you, Sebastian. Thank you, Teresita. The epidemiological situation in Mexico is the best that they have had throughout the pandemic starting a year ago. And most areas in the country are seeing green and yellow lights. We again urge the authorities to vaccinate as many individuals as possible, especially those who have the greatest risk of severe disease and death. Transmission is going down, and the positive situation in the country also shows us that the measures implemented by the population are effective. And this is the moment to continue with this, in particular with this parade that they are about to hold. So this type of mass event also increases the possibility of transmission, and it is important to continue with the measures and also all of the risk associated to this. Some of the measures to be implemented have to do with wearing their masks at all times, also to try to maintain the widest distance possible, and hand washing. If you have any respiratory symptoms, please do not go to that parade. Do not go to the All Souls Parade. And this applies to this is safe for the communities and for individuals. All Souls Day and the parade is an open air event. And by implementing these measures, we will be able to prevent another outbreak that has been so impactful in Mexico and in other countries. Let's implement those measures that have been positive, and let us protect all of the population so that we can use these festivities to obtain some comfort, happiness, and reduce the transmission of COVID-19 in Mexico. Over. Thank you, Doctor. The next questions are by Inés Capdevila from La Nación in Argentina, and also through the chat, Jason Bobien from NPR in the US. The questions have to do with the number of deaths in South America. The number of deaths is higher as compared to other points in the country and as compared to the number of infected individuals. Why did we have so many deaths in South America due to COVID-19? What failed? And Jason also has a similar question regarding the high rate of deaths due to COVID in Latin America. Dr. Aldigueri, thank you for those combined questions. If I understand correctly those questions, the journalists would like to compare the proportion of cases, not infected individuals, to the number of deaths throughout the world. As a matter of fact, we monitor the risk of death among those who got sick, and to that end, we use the ratio of the number of deaths reported over the reported number of confirmed cases, what we call case fatality ratio. I would like to underscore reported cases. As we know, there could be underreporting, and that underreporting could vary based on the region in the world and also based on the various sub-regions. For example, Central America vis-a-vis North America, South America, Canada. In the Americas, we believe that there is a better record of the number of deaths as compared to other regions in the world. Regions in the world that have middle to low income. And usually there is a trend to publish more fatalities in the region, in the Americas. However, this fatality rate usually increases with the higher number of patients that are impacting on the health services, on ICUs and hospitals, which become overwhelmed. Finally, we know that there were extensive outbreaks in our region as compared to other low to middle income regions. And at the same time, health services that have fewer resources than high income countries. So in the latter, that is to say high income countries, there was also a high number of deaths. So I hope I addressed both questions by the journalists. Thank you. Thank you, Doctor. In the chat, Tanya Smith-Cadway from the Tribune in Bahamas is saying in English.
The Bahamas started inoculating citizens in spring of this year. As it stands now, vaccine hesitancy is dwindling away. Should we now look into receiving booster shots? Dr. Barbosa?
Thank you for this question. First, this is good news indeed that the vaccine hesitancy is reducing. I think that more people now are aware about the benefits of vaccines. We have plenty data from many countries in the world showing that the risk to develop a severe case of COVID-19, to be hospitalized and to die to COVID-19 is much more important in people unvaccinated. In the US, the last data that the CDC released, for instance, shows that the risk to be hospitalized by COVID-19 is 12 times higher among unvaccinated people when compared to vaccinated people. So it's very important to receive this good news. The priority is still to get all the vulnerable groups vaccinated with a full scheme. So it's very important to go with the national plan that each country has developed following the recommendation from PAHO and WHO, vaccinating healthcare workers, the elderly people with chronic diseases, in order to get not only these groups protected, but achieving a high immunization coverage that can control the transmission. About the boosters and third doses, says the Strategic Advisory Group of experts on vaccines from WHO released a new recommendation 2 weeks ago, and we follow this recommendation. The recommendation in summary is that first, it's important to get everybody vaccinated. So the priority is still increase the vaccination and the access to vaccines. Second, that the countries needed to adapt these recommendations to their reality, to the access that they have to vaccines. Third, it's clear now that for people that have some conditions that can reduce the ability of the immune system to produce antibodies, people that are called immunocompromised, they need to receive a third dose. This is part of the recommendation, so these people can get protected. This is around 2 to 3% of the population, people that have HIV/AIDS, for instance, people that have some chronic diseases and need to take medicines that reduce the immune system activity and other conditions. This is valid for every vaccine that has EUL authorization, the emergency use listing authorization from WHO. AstraZeneca, Sinopharm, Sinovac, Pfizer, Moderna, and Janssen. And finally, there is a recommendation specifically for the vaccines that are based on the inactivated viral platform Sinopharm, and Sinovac. For these vaccines, reviewing all the evidence that is available, Sage is recommending a third doses for people that are sick, that are at 60 years and more. So for people with the elderly, they need to receive this third doses for Sinovac and Sinopharm. This third dose can be the same vaccine that was used for the first and the second, or if the country has more availability of other vaccines can be used. It was very well established now that you can have this vaccination combining different vaccines. This is safe, and this can be adapted to the situation that each country is facing. So in summary, it's important the reduction of vaccine hesitancy. Let's increase the vaccination coverage and to adapt this recommendation to the reality that you have in each country. Thank you.
Gracias, doctor. Siguiente pregunta está vinculada.
Thank you, doctor. This question is related to influenza, to flu. And in English,
What are the risks of flu? Is it circulating? Should people get the flu vaccine? Doctora Etienne.
So thank you for this question. In North America, influenza activity remains low overall. But there is a risk that flu could return this winter and cause cases and deaths. We need to remember that seasonal influenza spreads easily with rapid transmission in crowded areas, and this includes schools and nursing homes. So it is very important for people to get their flu vaccines this year. And we especially target health workers, older adults, people with chronic conditions, and pregnant women. In addition, children and marginalized populations at risk of severe disease should also be vaccinated. People who have not yet gotten their COVID-19 vaccine should seek out influenza vaccines while they wait their turn for COVID vaccines. WHO has said that inactivated seasonal influenza vaccine can be given at the same time as the COVID-19 vaccines, and those vaccines that have the WHO emergency use listing approval. So, and we need to stress this, getting both vaccines together is acceptable. Influenza can cause severe illness or death, especially in people at high risk. Hospitalizations and death occur mainly among high-risk groups, as we said earlier. Worldwide, the annual flu epidemics are estimated to result in about 3 to 5 million cases of severe illness and about 290,000 to 650,000 respiratory deaths. So it is important. Compared to previous years, our current influenza surveillance data should be interpreted considering the ongoing COVID-19 pandemic. So the various social and physical distancing measures implemented by member states to reduce the SARS-CoV-2 virus transmission likely played a role in substantially reducing influenza virus transmission last year. The pandemic also may have influenced health-seeking behaviors, staffing and routines in our flu sentinel sites and testing capacities. Importantly, the fact that people have not been exposed to the influenza virus because they stayed home or practiced physical distancing and other public health measures could mean that they have lower defenses, and this could make them more susceptible to influenza virus this year. And that's why it is so important to get your influenza vaccine this year. The fact that it can be given at the same time as the COVID-19 vaccines could make it more convenient for people to get both vaccines where they are offered together, reducing the number of times that you need to go to the health center. So we want to encourage everyone, particularly those at high risk, are included in the high risk groups, please go get your influenza vaccine. And you can get it at the same time as the COVID vaccine.
Thank you. Gracias, doctora Etienne. Siguientes preguntas, Natalia.
Thank you, Dr. Etienne. Now we continue with our questions from Indira Clark, asking about the criteria used by the United States to travelers and the requirement to be vaccinated with certain vaccines. So what does PAHO think about this? If these measures are inequitable? Yes, thank you for your questions. There is interest by the people now in this matter because many countries are authorizing international travel, and this is a significant topic. Therefore, PAHO and WHO have recommended clearly not to use vaccines with that have barriers to access by other countries when they're traveling. This could create discrimination with citizens from those who have rights because they have taken one kind of vaccine and others that have received other vaccines and cannot travel. So the conclusion is that this criterion of differentiating vaccines for COVID-19 should not be used. However, it is a sovereign decision that each country makes, and it is very important that countries can reach multilateral or bilateral agreements so that they can accept all the vaccines that are being used. I think this will be used, and it is in the interest of countries because it can facilitate tourism and business. It is in the interest of society. On the other hand, also, we are interested in that all vaccines may comply with all the requirements, and we urge everyone to submit all the information so that they can receive the emergency use license. So meanwhile, it would be important to have broad agreements that can facilitate travel and business in all countries of the world. Thank you. Thank you, Doctor. Next question is by Kevin Philmine from The Guardian in Trinidad and Tobago, and also from Melina Ochoa from Uno TV in Mexico. In English, the question reads.
There are reports on media and medical websites about the R1 and AY4 Delta subvariant. What does PAHO know about these two strains in terms of their origins, characteristics, and the symptomatology of people it infects? Is it a threat? Dr. Aldiguieri?
Thank you. So there are two questions in this question. Regarding the Delta variant of concern, the genomic surveillance has characterized more than 30 sublineages widely distributed around the globe and carrying some additional mutations. All these sublineages are classified only as Delta, including one of the mentioned AY4. And there is no evidence so far of any additional threat or any different transmission or clinical pattern. The AY4s, including the Americas, it has been detected in less than 15% of available sequences. Looking for these additional changes may help researchers track the virus on a fine scale, but they do not imply any functional or biological difference. Regarding the other part of the question, the R1 strain, it is considered as a variant, but not classified as variant of concern, nor as variant of interest. Its exact origin is not perfectly known. It was first detected in Japan in 2020, and since then has been detected in few countries. In the USA, R1 was detected among nursing home patients in Kentucky early in April 2021, but no additional sequences have been reported since August. This variant is circulating around the globe, and there is no evidence of any additional threat or an increased virulence. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. Tenemos dos preguntas vinculadas con el
Thank you,
retorno.
doctor. There are two questions related to going back to in-person classes at school from The Guardian in Trinidad and Yerson Collave from Comercio in Peru. Kevin says,
In countries that resumed physical classes, are there severe outbreaks or are students, teachers, and staff coping with school in the pandemic? Y Yerson Collave del Comercio dice que en el Perú los universitarios están próximos
in Peru, university students are about to start in-person classes, and they ask, what is the recommendation of PAHO to prevent outbreaks in these university spaces? Dr. Ugarte.
Those important questions. I will answer in English, okay? Why? Because there are some studies, particularly in the UK, that demonstrate what is the risk and which are the measures and how the implementation of the public health measures have impacted in the course of the pandemic. I would say that there is a strong correlation that have been documented in the UK and also in other countries between COVID-19 outbreaks, incidents, and the proportion of cases in school settings and university settings, ultimately resulting in outbreaks. Hence the importance of controlling community transmission to protect educational settings. So this is a very important context. So the schools are part of the community, and if the community is showing an increase in transmission, of course, this will go to schools. However, the incidence that the school drive transmissions in the community remains scarce, and it is further complicated by changes in the epidemiology due to the emergence of the new variants, as we all know. Since the beginning of the COVID-19 pandemic, the non-pharmaceutical control measures, meaning mainly mask using or mask wearing and physical distancing, have played a central role in controlling the spread of severe acute respiratory syndrome of coronavirus 2, SARS-CoV-2. Currently, many vaccines with good efficacy against SARS-CoV-2 infection and symptomatic COVID-19 are available globally. So even with the vaccination and these control measures, when restrictions were removed on some non-pharmaceutical control measures with, for example, not using masks or the distance is not being one of the measures that is being implemented in school settings, these have shown an increase in the sharp rise in the new cases and also mortality, even if the persons were vaccinated. This highlights the importance of non-pharmaceutical measures in controlling the pandemic trajectory outside the schools, especially in schools where a significant proportion of children are under the age of 16 and most of the students remain unvaccinated. There is a significant reduction in death rate where all classmates, for example, undergo home isolation upon detection of a single symptomatic case. That means that active surveillance and monitoring of the symptoms of the school or the students is highly recommended, and it is needed. And mask wearing together with social distancing and increased ventilation showed a similar very positive impact on transmission and mortality. In summary, school settings can be a potential source of COVID-19 infection that can spread in the community, and implementing non-pharmaceutical control measures in schools and universities can significantly impact population level mortality. And ultimately, reopening schools and universities, those decisions are very difficult. Trade-off between epidemiologic consequences and the emotional, educational, developmental, and social needs of children and their families. Into the future, there are difficult questions about what controls can be implemented in the schools, but particularly, meanwhile, the vaccination coverage is not at the levels that we want. The using masks, physical distancing, disinfection of hands are the paramount measures that we must implement when we reopen universities and schools. Thank you.
Gracias, doctor. La próxima pregunta es de...
Thank you very much, Doctor. Next, we have from Royston Jones from Eyewitness in Bahama in English.
Remain on a downward trend. Deaths continue to rise in the Bahamas. Is this trend being observed elsewhere in the region, and what can it be attributed to? Dr. Etienne?
Thank you, Royston. I'm from Bahamas. In the Caribbean, we continue to see a general downward trend, but there are some exceptions. So the Dominican Republic, Trinidad and Tobago, and Puerto Rico have all reported sizable increases in cases. As we said earlier, Barbados is experiencing a large increase in number of cases as compared with previous weeks. In some of the smaller islands as well, numbers of cases remain high. And unfortunately, we see steep increases in St. Kitts and Nevis, Anguilla, St. Martin, and the Cayman Islands. As I said earlier, we strongly urge countries in the Caribbean to maintain and prioritize public health measures to control the spread of COVID and to increase their efforts to vaccinate all eligible people against COVID-19. These measures and the widespread vaccinations are what the countries need to control the pandemic. It really troubles me that some of my Caribbean brothers and sisters have been slow to accept the COVID-19 vaccines that are being made available to them. And I was happy to hear from Antigua that vaccine hesitancy seems to be decreasing. If you have questions about the vaccines, ask your local health officials or the PAHO offices in your countries, or simply read the ample information on the PAHO web pages. There is really no reason to wait. The vaccines approved under the WHO emergency use listing are safe. They save lives and protect you against severe diseases. You heard the statistics that Dr. Barbosa said this morning in one of his responses. So please get your vaccinations as soon as you can. And meanwhile, please protect yourself by wearing a mask, ensuring physical distance of at least 1 meter from others, opening windows where possible, and avoiding the close, crowded spaces. And wash your hands, disinfect your hands frequently. Most importantly, please get vaccinated as soon as it is your turn. And this is an individual as well as a collective movement to ensure that we can reduce the incidence and transmission of COVID-19 in our population.
Gracias, doctor Etienne. La siguiente pregunta es
Thank
de...
you, Dr. Etienne. Now from Henry Cárdenas from La Prensa in Panama. What is your balance on the process of vaccination in Panama, where they have reached 76.4% of the target population vaccinated with full scheme? And what does PAHO think of the decision of Panama to donate vaccines to other countries? Does this mean that Panama has controlled the pandemic? Dr. Barbosa, thank you. It is important to confirm that coverage in our region has increased, even in Panama. This is good news. It is also good news to have solidarity shown by Panama with the initiative of offering to donate vaccines. It's not a sign that the pandemic has ended in Panama, but it shows the solidarity of Panama with the sister nations in Central America. So we're trying to support Panama and the countries who will be receiving the donation. So all the regulatory, legal, logistical aspects can be cleared. Also, it is important to underline that since we do not have as yet or there's still some uncertainty of what is the plateau of vaccination, what is the amount of vaccination that once we have reached that, it means that we have controlled transmission. So it is important to continue in our efforts to vaccinate and at the same time maintain the public health measures, especially enclosed in areas using masks is always very important, and keeping the physical distance. All of these measures that we mentioned here, they are important until we have been able to control transmission. Coverage with vaccines is the most important pillar to achieve control of transmission. However, in cities where there are still cases and deaths, this means that there is a transmission in the community. And yes, people are more protected by vaccines, but they still need to continue with the protection measures. And other countries should follow Panama's example, as well as other countries who are beginning to share the doses. Countries, not only developed countries, but even developing countries in our region who have had very important solidarity gestures, because protecting each country is linked to protection of all countries. If we do not have control in all countries, no single country will be completely protected. So this solidarity is very important to guarantee more equitable access. Thank you very much. Thank you, Dr. The next question is from Sami Paula Martinez from Transparencia Venezuela and from Violeta Villar from La Web de la Salud in Panama. They want to know what advances are there in the cases of yellow fever in Venezuela and epidemiological surveillance within the context of the pandemic due to COVID-19. Dr. Aldeguerri, thank you very much for that follow-up question. A couple of weeks ago, we did hear comments about this topic. It is important to remember that Venezuela is one of the 13 countries where yellow fever is endemic in the Americas. So unfortunately, we have expected cases in these 13 endemic countries. In the particular case of the event in Venezuela in the last few months, human cases reported by the health ministry in Venezuela are framed in the context of an epizootic wave, meaning cases in monkeys, and they have been confirmed in Omagas and Anzoátegui states in the northeast of the country. The cases in Oman, the Monagas has reported cases in humans, and it is important to highlight that this is a wild transmission. So from the epidemiological review published on October 13, we have not received any more reports of other cases of yellow fever in Venezuela. And the prior event had been detecting a case in the state of Bolivar at the end of 2019. I would like to emphasize the close cooperation between PAHO, our country office in Caracas, the regional programs based in Washington, as well as the national authorities. This cooperation to strengthen surveillance of yellow fever, both in human and in non-human primates, and also regarding the vaccine response. So I hope I have answered your questions. Thank you. Thank you, Doctor. From Steven Cyrillian from BJ2 Radio in San Martin in English.
Numbers in some Caribbean countries. Do you think there should be a vaccine mandate in place? If yes, can you say why? If not, what better way do you think countries can effectively get the virus under control? Dr. Barbosa?
Thank you for this question. You know that every country has a different national law about immunization. In many countries, for instance, the immunizations are mandatory for children to go to schools. We can understand when countries are considering to establish mandatory regulations or laws about the COVID-19 vaccination. Many companies are also thinking about that. We can understand this because this is a deadly disease, and it's not acceptable that having a vaccine available, many people are still refusing to be vaccinated, because this is a danger not only for this person, but this also is a threat for its family, community, and country. So we can understand that. We don't recommend mandatory, generalized mandatory laws, because each country has its own sovereign decision. I think that the most important thing now is to understand what is happening, because only to establish a mandatory law maybe cannot be fully effective to convince people that are reluctant to get vaccine. So we do believe that the real measure that can change the game is trying to identify what are the groups that are resisting, that are reluctant, how we can reach out them with information based on scientific evidence, how we can get the nurses, the physicians well informed, because in many cases, they are the first person that a family asks about vaccination. So it's important, more than to have or to think that a single measure will solve this complex problem. We need to identify what are the causes, what are the real barriers, what are the doubts that you need to respond, and to establish a communication strategy, and to establish a mobilization strategy to get the physicians, the nurses, the scientific community, academia, civil society, media vehicles that play a very important role in order to get them. Because if this is a very complex pandemic, because we have many political disputes, so it's important also to call the politicians to not use the vaccination as a political tool, one against the other, but that everybody needs to share the information that we have, and the information are clearly telling us the relevant role that vaccines have to protect people. This is one vaccine that is being used widely in many countries that have excellent surveillance systems. So vaccines against COVID-19 are safe and are protecting people, are saving thousands of lives, and they are the best way to recover the economies, to reduce the tremendous loss that this pandemic has provided. So I think that it's important to think about this comprehensive response that control the transmission of this so deadly and so important pandemic. Thank you.
Gracias, doctor. Estamos llegando ya al final de la sesión del día de hoy. Y la siguiente pregunta es...
Thank you. We're coming to the end. And the next question is from Marga Paredes, reporter from New Day from Puerto Rico. And she says that the rate of positivity of COVID-19 in Puerto Rico is at 2.9%. Recently, about a month ago, it was over 10%, which reflects a considerable decrease. At this point in time in the year, we have had a similar scenario, or at different times, they've had a similar scenario where the transmission goes down, but then there are increases that may lead to a lack of control again. So she wants to know what other countries have done to maintain cases under control. Dr. Etienne.
Voy a responder en inglés. Let me say that really we are pleased when we see cases and positivity rates falling in some countries, because this means that we are getting closer to being able to control COVID-19 outbreaks. The most important steps that we can take are to track and manage infections closely. Remember, we said even focusing at the local level, to adjust the crucial public health and social measures accordingly, and to increase the rate at which we are vaccinating our populations. Last week in my remarks, I outlined some of the scenarios that countries face, depending on implementation of public health measures and vaccination coverage. As we stated then, the most desirable of these scenarios is that we see reduced hospitalization and deaths due to consistent public health and social measures on one hand, and high vaccination coverage on the other. And we really hope to see this happen in more and more areas and countries. In some countries, we may see continued high rates of community transmission due to low vaccination coverage and insufficient public health and social measures. In others, however, there could be periodic spikes in transmission when public health and social measures slip, or if vaccine coverage dips. As we have reported to our governing bodies consisting of our member states, suppression of COVID-19 in the Americas will continue to require a comprehensive response. With sustained health services network capacities, public health and social measures, targeted vaccination operations, and outbreak control actions, such as early detection, investigation, and isolation of cases, and tracing and quarantining of contacts. I think you've heard us say this over and over again. Certainly, even today, this has been repeated several times. So public health and social measures must continue, even where acceptable vaccination coverage exists. And continuous planning for responsive healthcare services delivery during COVID-19 surges remains critical for the medium and long-term control of the pandemic. Really, this is both an individual and collective responsibility. And national authorities also must play a role. But as we've said several times before, it is only together, each of us doing our part, that we are going to arrive at a point where COVID-19 as well as SARS-CoV-2 is controlled in our region and beyond this global. Thank you very much for joining us this morning, and may you have a wonderful day and rest of the week. Thank you.
Muchas gracias, doctora Etienne. Ahora sí, entonces, hemos llegado al final de la sesión de
Thank you,
hoy.
Dr. Etienne. This is the end of our session today. Our webpage, www.paho.org/coronavirus, has a great deal of information about the situation of the virus and the pandemic in the region of the Americas. Thank you once again for joining us, and we'll see you next week. Greetings.